This may be a rabid squirrel. It is fearless. It does tricks. It likes to attack people. He just wants to say hi. The squirrel is apparently a zombie squirrel.
A rabid zombie squirrel.
Wanting blood, perhaps.
God.
Jackie is the very fearless zombie hunter.
Fearless, alright. What if it just leaped onto your face? Oh my god!
It is,
call someone, Mom says.
Call someone.
Stop it. It's a baby, guys.
Yeah.
What?
Call someone to come pick him up.
Come pick him up? Okay.
Call 911. No, Jeff, you
I'm getting some good video first.
I'll get video. Hey, Squirrely, stay here.
Okay, I'll call somebody.
ಡಂಫಮ್ ಮೂಕ ರೀತಿ ಅಂತ ಹೇಳಿ ಕರೀತಾರೆ ಇದನ್ನ. ಬೊಗಳಲ್ಲ, ಜೋಲ್ ಸುರ್ಸಲ್ಲ, ಏನಿಲ್ಲ ಜಾಸ್ತಿ. ನೋಡಿ ಅದು ಹೆಂಗಾಡುತ್ತೆ.
I am speeches my want the dangerous animations be spy with the power that is power. Come on, let's be all spies. Jesus.
Oh. My God, something's wrong with it. Oh my God.
Normally, rabies is only contracted by getting bitten by a rabid animal. But case reports have been published of people coming down with rabies without any such history, like these two from Vietnam. In a truly kind of man-bites-dog story, they both came down with rabies after butchering and consuming a dog or cat. The rabies virus should be killed by proper cooking, but they think it was in the preparation of their brains that may have generated large amounts of virus. The dog's brains were eaten steamed, but the cat's brains were pulped with bare hands to make some special dish. The doctor suggests that butchering and consumption of dogs should be really better regulated, as high as 2% of dogs in slaughterhouses may be infected. And about the same percentage has been found infected in China. In fact, the long-distance live animal transport of dogs for the meat trade may be a factor in the massive human rabies epidemics in southern China, where farmers can get as much as $12 to $15 per dog. The dog meat trade may also be playing a role in the spread of rabies in the Philippines, though again, as a doc with the Department of Health pointed out, if the animal is cooked, the virus is destroyed. But many are eaten raw, and even if they are cooked, there may be cross-contamination during handling and preparation. Anyone cutting up a dead dog can transmit the virus to themselves if they touch their eyes or lips while they have traces of the dog's fluids on their hands.
Mijn vriendjes luisteren maar spijnings. Carol dat pulse building bij ons minded in smiling. John, I finish in my shoe. God, she must buy. College. Silence, you like. Buy some guy. The power. My boss is nice. Cool day with my one boy. Send my own board. He is nice. Darling. I was my. Sorry, I wasn't saying it was possible. So, was feeling constraints. Cow, I see it. I'm sure it's fine. I choose
my largely responsible for transmission of rabies in Asia is the dog. Besides cats, monkeys, it must be noted that the saliva of a rabid animal is infective 2 to 3 days before signs of rabies appear in the animal. Clinical features. Rabies victims suffer horrifying symptoms and eventually die. Most pathetically, they know that the disease has no cure and they will die soon. The rabies victim dies a solitary death in isolation hospital ward, away from relatives, dear and near ones. The victim's hands are invariably tied to the cot by bandage or ropes. They are unable to drink even sips of water, undergo great pain and mental agony, and in most cases with full awareness. Prodromal phase. Tingling and numbness are experienced at the site of bite 2 to 3 days before clinical symptoms appear. Later, low-grade fever, headache and body ache are reported. Clinically, subsequently, patient develops painful spasm of the muscles that control breathing and swallowing, resulting in drooling of saliva, and person cannot swallow and voice may get hoarse. The pupils may get dilated. Tears and perspiration increases. Blood pressure becomes low. Patient develops hydrophobia, fear of water. Photophobia, fear of light. Aerophobia, fear of breeze. Later, as the disease progresses, patient gets agitated, combative and destructive. Shows mental confusion, becomes sensitive to touch, noise and light, gets extremely thirsty but unable to drink because of painful spasms in the throat. develops dehydration, loss of muscle tone, and listlessness is seen in majority, and eventually death occurs in 3 to 5 days due to respiratory paralysis or cardiac arrest. Paralytic rabies is seen in about 20% of rabies cases. Here also, initially, the patient experiences tingling and numbness at the site of bite 2 to 3 days before the clinical symptoms appear. The paralytic type of rabies is seen usually in patients who had taken some anti-rabies vaccination in the past.